We're going to be talking about your policy manuals and what's next when you receive those policy manuals. So today we're going to talk about familiarizing yourself with the policy manuals in your thumb drive. We want to make sure that when we come to do your site visit with you, that you've opened your policies, you've familiarized yourself with them, and that you've completed certain policies so that we make the most of our day together. During the webinar today, we're going to talk about the welcome letter that you're going to receive with your policies, the checklist that you need to complete before we come for your site visit. We're going to overview the chat crosswalk and why that's going to be important to you during your survey. And then lastly, we're going to talk about what's on your thumb drive or your USB. So in the beginning, once we sign you up as a client, someone from the publishing department is going to be contacting you to ensure that you've completed your information sheet. On this information sheet is your agency name, your address, phone number, the name of the key people inside your organization. And the reason why that sheet is so important, that it's correct, is that we are going to use that to create your policies and especially make those special for your agency. So inside those policies that we've written, first of all, they're going to be based on both your state regulations, the accreditation standards that you're going to be going through, CHAP or possibly ACHC. And we're also going to ensure that there's policies there to make sure you're compliant with some of the federal regulations. Not only Medicare, but also OSHA, the FDA, the CDC. So when we create your policies, we customize them to include the name of your administrator, your agency information, and this is going to be things like the counties that you cover, your agency, address, phone number, hours of operations, all of those unique things about your agency. And then finally, we're going to watermark your policies with your agency name. Those will be across each one of your policies. So when you get your policies, these are all the policies that you're going to receive. So you're going to receive a number of manuals. But inside those manuals, you're going to receive a chat crosswalk, and we're going to talk about that in a little bit. Your administrative policies, all of those policies will be together, and they will all begin with a number 1. Your patient care policies, again, talk about how you're going to take care of the patient, you're going to admit the patient, discharge the patient, so forth. Those all begin with the number 2. Your financial policy manual are your number 3 policies. Personnel are going to begin with the number 4. Infection control are going to be number 5 policies. Emergency disaster 6, safety 7, your quality assurance performance improvement, also known as your QAPI, QAPI, they're going to begin with 8. You're also going to get a separate manual that contains all of your HIPAA policies. We're going to talk about that specifically in a little bit. You're also going to receive a manual that's going to have all of the job descriptions and performance evaluations. Now, some of those job descriptions you may not use at this time when you're first starting out, but eventually down the road as you get larger, you're going to want to have access to those job descriptions. It doesn't mean that because you have a job description in that manual that you have to have somebody for each one of those jobs. That's up to you as to how many you have, other than the required ones. We also give you a USB or thumb drive with all your forms on it. We're going to talk about that in a little bit as well. So one of the things that you'll need to do when you get your policy manuals, you're going to need to locate the instruction letter and the check sheet. We provide that in the front sleeve of your administrative policies. Also, the other thing that will be in there that we'll talk about is your USB will be in there as well. So it's imperative that you read this welcome letter and that you complete all the items on the checklist. If you're not sure about how to complete a specific item on that checklist, you can either give us a call in the clinical department, or you can, hold on to that and mark it, and then we'll look at it together when we do your site visit. The one thing that you most definitely need to know is you need to be familiar with your policies and where to find policies. And part of that is knowing and reading through at least the table of contents. We don't expect for you to know every policy by heart and to be able to rattle them off, but we do expect for you to know that they're lumped together in certain categories and that you can utilize your table of contents to find a policy. And then lastly, we want you to be familiar with what's on your thumb drive. And I'm going to point out some key folders on there that you will be accessing frequently. First of all that we want to talk about is your postings that have to be in your office. And these should all be up when we come to see you on your site visit. We'll take a look around the office to make sure all these are up, and we'll point out to you if they're not. But again, we provide you, along with that welcome letter and that checklist, we provide you with your mission statement. We provide you with the OIG fraud alert notice, and we also provide you with the HIPAA privacy notice. All of these need to be up in your office, preferably in the front part of your office. When you first walk in, if you're in a single room, then it's just going to be there on a poster board or a cork board or however you want to put it. You can frame them if you want and put them up. The HIPAA notice you're going to need to complete. It will require you to put your agency name on there and date it before you put it up. Also, that needs to be posted in your office somewhere is the Patient Bill of Rights. This you can find in your policy manual, and you can also find the Bill of Rights in the patient admission information booklet. We're going to talk about that in a little bit. Once you get your CLIA license that you have to apply for if you're doing Medicare, that allows you to do certain lab tests in the home. That needs to be framed and put up on the wall, and we'll look for that. Once you receive your state license, that needs to be framed and put up on the wall. Over all of your exit doors, you need to have signage saying that that's an exit to the outside of the room or the building. It either needs to be a illuminated light, or it needs to be a reflective light sign, say from Home Depot or Lowe's or somewhere like that. And we also will look to make sure that you've got an office diagram of where all the exits are, including where your fire extinguisher can be found. Those diagrams we also give to you on your thumb drive. So if you want to use that form and alter it to make it specific for your office, you can. Lastly, we'll look for your 5-in-1 poster, employee poster. This is the one that you'll need to order online. We talked about that in the setup webinar that lists all the minimum wage and so forth for your employees. Normally, we see this employee poster like in a break area or maybe a charting area or wherever that your employees will be coming up in to pick up supplies or drop paperwork off. So part of your checklist tells you a number of policies that will need to be completed. The first one that will need to be completed in the front of your administrative policies is your policy review page. Your policies need to be reviewed, and this page needs to be dated and signed at least once a year. The person that's going to sign this page is the chairperson of your governing body. The date that's going to go on that page with that signature must match up with your governing body minutes. The governing body is the one that approves your policies. So anytime the policies are approved and or reviewed, revised, deleted, added, that needs to be reflected in your governing body minutes, and there needs to be a signature and a date on that revision page. Again, we'll be checking that with you when we come. Policy 1.9, again, remember ones are in your administrative policies. is policy regarding the services that you're going to provide. And this one is really important that it matches exactly what you're going to tell the surveyor, the types of services you're going to provide. Under Medicare, you have to provide at least one service directly to be able to qualify for a Medicare certification. So that one service means that those services have to be done by a W-2 employee. It can't be an independent contractor. It can't be a contracted therapy company. Usually it's going to be nursing, but it might be home health aid, it might be therapy, but again, we will validate that with you when we come out to see you. So you're going to mark all the services that you're going to be providing through your agency, either by a direct employee or through a contracted service. Remember, whatever services you have marked there, you have to have representation of each one of those disciplines that serves on your PAC committee, your professional advisory committee, your QAPI, and your record review committee. And those have to match exactly. This is a very frequent level condition deficiency when we have survey, because this page doesn't always match up with your committee members. So again, we'll be looking at that in detail with you when we come. Remember too, you can add services and revise services after the survey, but if you do that, you'll need to change your committee memberships and so forth and so on. And we'll talk more about that during the site visit. Policy 1.29, again, we're still in the administrative policies. You have a policy where you're going to need to list what you would charge for private pay services. Nursing, therapy, home health aid, social worker, speech, whatever. And the rate for that private pay has to be consistent for all your patients. If you're going to be billing Medicare, which the majority of you probably will be, we recommend that you use the LUPA rates. And we give those to you. The 2015 ones are on your USB, and you can find them when you open up your USB. You can find them under the client-related folder, then the OASIS folder. If you're not going to be billing Medicare and you're not sure what rates to put on there, a formula that you can use is to put a rate 2 times the amount that you pay your employee. So if you have an RN and you're paying her $40 a visit, then you need to put that you're going to charge at least $80 for an RN visit. Again, you want to make sure, though, and do a little market research in your area to make sure that your pay rates are competitive for your market, so you're not outpricing yourself. Still in the administrative policies is 1.31. This is the policy that you're going to complete with the names of the individuals that are going to be in charge in the event your administrator and or your director of nurses, director of professional services is not available in the office. This needs to match up with your organizational chart that's also in your administrative policies. And remember also that the governing body is the ones that appoint all of these positions. So anytime these positions change, the governing body has to re-meet and reappoint replacements, employee replacements. And again, that needs to be in the minutes. All those dates need to match up. Make sure you're not appointing someone to a committee or to a position before they've actually been hired. We see that sometimes on minutes, and that's a frequent deficiency for your agency. So again, we'll look at all those, but just make sure that that policy has been completed with names, and it also requires signatures of those individuals. In your personnel policies, that's the number 4 manual. There's a couple of policies in there that you're going to need to complete with your agency information, and this talks about if you're going to offer vacation or benefits, also if you're going to provide mileage for your employees. If you're not going to provide these to your employees, then you need to mark NA on those policies. And then if you don't, make sure that that's reflected in your employee handbook, that you're not offering those. Again, we'll talk a little bit about where to find that employee handbook on your USB. Number 6 policies that you're going to need to look at and complete are found in your emergency disaster manual. These policies are important because it talks about how you're going to maintain and manage your operations in the event you have an emergency. This could be a man-made emergency, it could be a natural disaster emergency, a flood, a fire, a terror attack. And again, you're indicating where you're going to operate in the event you can't operate at your current location. So you will physically need to enter a spot, an address. You don't have to have a contract. It can just be some place that you have identified where you would operate. It could be a home, it could be a church, it could be another office, it could be a hotel. Again, but you're going to have that identified in your plan. This alternate location needs to be located somewhere convenient for your employees, that they can pick up supplies, get assignments, and maybe drop off documentation. Again, you want to do everything you can to maintain operations the best you can to your patients during this time, because if you've had an emergency, it's probably affected your entire area. So a lot of these patients are going to need to stay in the home. They can't all go back to the hospital to be taken care of. If you're in Florida or Texas, you're also required to have a CEMP, or a Comprehensive Emergency Management Plan. We provided that to you when we helped you with your license application. So you need to be familiar and have that available also for your surveyor, and be familiar and know what the requirements specific for your state is. And we'll talk more about that when we come on site, but we want you to be familiar with that too and have completed the requirements of that. Your HIPAA manual is another manual that we provide to you. This one's going to need a little bit more completion on your part because it's unique to your agency, and it's going to depend on the types of computers that you have, if you've got a local server, if you're doing a cloud through a software, if you're doing all hard copy charts. So we don't know that. We can't complete that for you. So you're going to need to open that manual and you're going to need to read through the entire thing. So we've listed pages there for you to complete in your HIPAA manual. And that should be done by your administrator, who is also identified as your privacy officer. The privacy officer's responsibility is that if any patient, family, employee files a complaint with your agency that they've had their protected health information violated or breached, that you as the privacy officer have to assist them to file a complaint with the federal government. So be aware of that and make sure that that's all complete. We'll look at that with you when we come on site. One of the things also part of the HIPAA is the Business Associate Agreement, or the BAA. This is an agreement that any vendor that has access to your patient information should sign and return to you. I've given you some examples of vendors there. We're a vendor for you because we're going to be surveying and auditing your personnel charts and your employee or patient records, excuse me. Your software company has access to all of your patient information. A therapy company would be another one. Again, they have access to your patient information. And then another one on there is the shredding company, if you decide to use the shredding company. The BAA is really designed to protect you. And what the BAA basically says is that the vendor is signing that they're taking responsibility to protect any information that you share with them or give them access to, and that if it's breached, they're going to be held accountable. So the government would go back to them and not you. So again, you need to make sure that those are signed by all of your vendors. And once they're signed, you can just place them in your HIPAA manual and keep them there. And the surveyor will probably ask to look at those. The other thing that we provide to you that's very valuable, particularly during the time of the survey, but you certainly can reference it and be familiar with it before your survey and even before we come to make your site visit. It's located in the front of your administrative policy. The crosswalk is to set up so that we've listed all of the CMS regs and tags. We also have identified the CHAP standard, and then we give finally the column that identifies your policy number or forms that's going to demonstrate compliance with those requirements. So this crosswalk is really important that you have it available during your survey, so that if the surveyor references that you've not met a CHAP standard or a CMS standard, and you can utilize a crosswalk and say, but here's the policy that, or the form that shows that I am compliant, and hopefully avoid a deficiency. So again, be familiar with that so that you can utilize that during your survey. This is what it looks like, you know, all the columns, and then that next to the last column is where we've identified your policy number and any forms that is going to keep you or make you in compliance with that standard or that CMS regulation. We provide also to you a thumb drive or a USB. We're going to give that to you when we send your policies to you. We put it in a small little envelope because it's sometimes easy to get lost. It's white and it's got the blue and red Allure logo on it. They donate those to us, so we are able to use those. It looks like kind of like an eraser. It's a white rubbery. The end actually comes off, removes off, so that you can have access to the plug-in. You only need to print off items on the USB as you need them. Please don't print everything that's on that thumb drive. It's thousands and thousands of pages. Again, the USB contains all the forms to support your operations and to make you in compliance with your policies. We do not put your policies on the thumb drive. There are some policies on there that we know that you will need to change from time to time, including the ones that we talked about on the checklist. But your entire policy manuals are not on the thumb drive. We don't give those to you in Word because they're copyrighted. To be able to navigate that USB a little bit easier, we provide you with a table of contents. And that's the #1 folder when you open up your USB. I'll show that to you on the next slide. And then you also, to help you find a document in that thumb drive, you can also use the search bar. And I'm going to show you how to use that. So when you plug in your thumb drive and it opens up, you can see there #1, we've got the index. So if you open that file, it will tell you where all of the forms are. But if you just open up and you want to look for a specific form, this one I put in LUPA up into the search bar in the upper right hand corner, you'll see that. Once I put that and I press that little magnifying glass there, then it'll bring up all the LUPA forms that's on that thumb drive. So we've got 3. We found LUPA in 3 different places, so we'll click on those and open that up, and that'll be hopefully what it is that we're looking for. So again, please utilize the table of contents and the search button to locate a document on your thumb drive. If you still can't find it, you can give us a call in clinical and we'll help find that for you. Occasionally, some of the folders don't copy exactly, and we have some quirky things that happen. So we want to know if you've done your search and you still can't find it. We want to make sure that you have a functioning USB. These are some of the more important folders that's on that USB that you're going to need to access, and I would even recommend maybe that you download these folders onto a desktop, maybe on 1 or 2 computers in your office, or even whoever you want that can have it. The nursing procedure folder, that has all of your entire procedure manual on any nursing task that's going to be performed by the patient. Wound dressing changes, inserting a Foley catheter, removing staples, any of those types of things. And during your survey, if the surveyor sees a patient that's having any of these procedures done, they will ask to see your procedure for that particular task. So again, you can open it up and show them, have that as their reference. You also have on there your employee handbook and your orientation booklet. And again, those are ones that you're going to need to have access to, so that as you hire employees and you orient them, they're either going to need to have a hard copy, or they're going to be able to at least be able to read that on the computer. Contracts are there, so that if you need a contract for your medical advisor, an independent contractor, a therapy company, all of those contracts are there. We also provide you with a folder with your patient information and mission booklet. Now, we give you with your policies a sample of this booklet, but we also know that you're going to need to reproduce that booklet many, many times. So we give that to you in a Word format on your USB. And you can go in and customize that and make it your own, if however you want to. Your education plans for your employees are on there. That's all the in-services. The mandatory ones are in there, and also some additional ones that you can provide to your employees. And then your logs are there. Your logs are like all of the documentation you're going to have for checking your fire extinguisher every month, your complaint logs, your incident reports, your infection control logs, all of those things that you're going to need to document things that are happening in your organization for an ongoing basis are in there, and you can reproduce those. For your patient information and admission booklet, we provide you with a sample of this entire packet. And remember, this packet we have customized specifically for your agency. So it's got the name of your administrator, your address, your phone number, all of the specifics regarding what's required for you to provide to that patient or admit that patient. We don't want you using that sample. That's meant to be a reference for you to have for your survey and to have on your shelf along with your manuals. Again, like I said, you can customize it. The one thing we don't want you to do is remove anything in those booklets unless you check with us first and confirm that it's okay to remove, because we put it there for a reason, either to meet a standard or a state regulation. So again, if you want to change the font or put your logo on it, that's fine. We don't care however you do that, but again, talk with us if you want to remove items and make it smaller. Again, you're going to want to print some of these booklets and have them on hand for your clinicians, because every time a patient's admitted, you're going to need to have one of these booklets to admit the patient. And we give you instructions in it as to what needs to stay with the patient and what needs to come back to the office. The items that come back to the office is what starts the patient chart. And we also have a webinar that talks about setting up the patient chart and admitting the patient. So we want you to listen to that as well. The one thing that you are going to need to provide as an addendum to this admission booklet, we provide it to you as a sample in the reference one that we give you, but you're going to need to make arrangements to have hard copies or software access to the OASIS C1 and the medication profile. The ones that we give you are from MedPass. The OASIS C1 you can use from anyone, Briggs. We provide one on your thumb drive. You can access it as CMS. But I do recommend that the medication profile you look at, and if you don't have software, to buy the one from MedPass. It meets all the requirements for the CHAP survey, and it's just a really good documentation tool for all the medications. This is what the patient information booklet cover will look like. Where it says click here to enter text, we will have done all of that. That's where we put your agency name and address and phone number. And then also the logo that's on the patient information is a standard logo that we use. If you have your own logo, you can send that to us before we start printing the patient information booklet, or you can change it once you get it on your USB and make it your own. That's one of the things that you can use to customize it. So in summary, some of the things that, are imperative that you do prior to us making your site survey, again, that'll make that time with you a lot more valuable, and we can make sure that we get everything covered. Is that we want you to open up your policies as soon as you get them, read the welcome letter, and complete the checklist. If you're not sure about something on there, please give us a call in clinical, or you can save your question if you want to the time we come for the site visit. But we'd like for that policy checklist to be completed by the time we come and see you. Make sure all your office postings are complete and up. Be familiar with what and how to find things on that USB. There's certain things on there you're going to want to print. That includes the patient information and booklet, information and admission booklet. And then we also want you to be familiar and understand how to utilize that chat crosswalk for your survey. So again, if you have questions, please don't hesitate to call us in the clinical department, and we'll answer any questions. And then also we look forward to seeing you on your site visit so that we can finalize everything with you and get you ready for your CHAP survey. So thanks a lot for listening, and you guys take care.